One of the lingering conditions that COVID-19 can cause is the damage it can do to your heart, and that can last a while. It's very concerning. It's something that's different, of course, in everyone, but it is something researchers continue to look into. Now, joining us this morning to talk a little bit more about this and why you need to get that shot, Dr. James Lott. He's Dr. James Lott III. He's the board certified in pulmonology and critical care at Princeton Baptist Medical Center. Joining us now by FaceTime to talk more about it. Good to see you this morning, Doctor.
Good morning.
I mean, I know it's kind of Captain Obvious to say why we need to get the COVID-19 shot, but particularly for folks who do have some heart issues because of what they have seen in some preliminary research studies about the damage it can do to your heart, right?
That's correct. There are all kinds of unintended consequences from the infection. Of course, it primarily involves the lungs, but we are seeing a lot of people that wind up with cardiomyopathy, which is a inflammation and disease of the heart that causes people to have heart failure, as well as cardiac arrhythmias or abnormal heart rhythms as a result of having had COVID-19 infections. Now, a lot of these things are long-term, and as far as we can tell, we don't really have too long-term of a follow-up on many patients, but people are being called long haulers in terms of having long-term complications as a result of the infection.
And obviously, I mean, we just really went through 1 year this pandemic, so we may not know for maybe years to come just how damaging this can have on your heart, how much damage it could cause. When you look at the spectrum, the severity of this disease, though, can you put it in perspective, and also in terms of age groups? In other words, like a younger person who gets COVID, could their heart also be damaged?
Absolutely. We really have not been able to stratify it definitively into who's going to get sick and who's not. Unfortunately, we don't find out until these people hit the door of the hospital whether they're going to be in that really bad severity of illness where they wind up having to go into the ICU on ventilator support, or whether they're just going to have a sniffle and get over it quickly. We have seen plenty of young people that come in and had to be hospitalized for weeks. And we wind up discharging some of those people to rehab. Some of the people, wind up passing away in our ICUs. But it really does not discriminate completely with age and or other comorbid illnesses.
If somebody has had COVID-19 and they did have symptoms that were maybe not necessarily got them hospitalized, but they were in pretty bad shape for a while, what would you recommend in terms of getting their hearts checked? Would it be a normal, just a heart test, getting on the treadmill, the EKG test, those type tests, or does it need something more than that?
We primarily base that on symptoms. I mean, of course, everybody that comes in the hospital is going to have EKGs performed. And if there's any question at all, any indication that there's abnormalities, most people will get something called an echocardiogram, which is an ultrasound of the heart while they're hospitalized. As far as follow-up, I think that just depends. It's individual dependent on what symptoms they have when they go home from the hospital.
What would you like to stress to folks, though, because there are a lot of people who are on the fence about getting the vaccine. They're kind of in a wait-and-see attitude. Maybe they're not trusting of it. What would you want to say to those folks?
I would highly encourage everyone who has the vaccine available to them to get the vaccine. Unfortunately, you don't know which classification of severity of illness you're going to be in until after you get infected. And what I tell people is I don't want to find out. I have not heard of anyone dying from the vaccine. I see people die every day from COVID-19, and I don't want any part of that.
All right, that is Dr. James Lott III, board certified in pulmonology and critical care at Princeton Baptist Medical Center. We appreciate your time and some of your perspective on this. Thank you so much, sir.